Good evening, Doc. Good evening po sa lahat. Okay. Tonight, continuation po, greasy tongue coatings. Okay. A yellow tongue coating does not just reveal the penetration of externally contracted pathogenic factor. It also reflects internal patterns of disharmony. So this type of coating is common feature in clinical practice. So yung yellow tongue coating. So this one looks sticky and dry and is often of a thick consistency, which in the case of an ear disease reflect an accumulation of damp heat or phlegm-heat. So having a sticky and dry, tas yellowish siya, this is masasabi natin na accumulation of damp heat or phlegm-heat. If the coating is more yellow and dry than sticky, so ito yellow and dry, then heat is more dominant factor. So mas maano po yung heat dito dahil mas ano siya sa yellow and dry. If heat meets with accumulation of dampness in the interior over a period of time, the heat will interact with accumulated dampness resulting into phlegm heat na. So from yung ano tawag dito, yung heat lang muna and this interacts with dampness, nag-result ng phlegm heat. This process of dampness transforming into phlegm is reflected in a rough or sticky consistency to the coating. So pag pumasok na po, naging phlegm na, nagiging rough or sticky ang consistency. If the coating is thin and of a light yellow color, kung manipis tapos light yellow, the dominant factor is accumulated dampness na po. Okay, light yellow color and thin, so yun po dampness, okay? In the case of acute food stagnation, the coating will be greasy and of pale yellow or slightly gray color. In such cases, it is generally located in the center of the tongue and reflects the stagnation of qi in the middle burner. So ito po yung may food stagnation. If disharmony persists for a long time, the coating will become thicker. So pag tumagal ito, mas kakapal po yung coating, which commonly associated with aggravation of the symptoms. A white thick greasy coating naman is associated with cold dampness or phlegm cold. So kanina may yellow thick greasy, ito white thick greasy coating. So this one is cold dampness or cold phlegm. This type of tongue coating will be accompanied by such symptoms as a sensation of heaviness in the body. So may mabigat na pakiramdam, a feeling of fullness in the chest, parang puno po yung pakiramdam sa chest, and epigastrium. Tapos meron siyang lack of appetite. So dito we have another slide, picture ng tongue. Yung tongue description, first this is a male, 75 years old. Ang tongue description niya po, meron siyang reddish blue with a blue and black points. So meron po siyang blue and black points. Observe po natin dito po sa may sides. Ibig sabihin, meron siyang heart blood stasis. Meron din siyang greasy white thick coating. So ito po, greasy white coating, thick coating. Ibig sabihin, accumulation of cold dampness and food stagnation. Ang patient natin, meron siyang symptoms of feeling of fullness in the chest and epigastrium. Meron siyang pain in the chest, may dry cough, palpitation, and sour taste in the mouth. Sa Western diagnosis, this is a case of angina pectoris. Ang background of disease, smoking for many years, and physically overworked. Okay po? So we have another case ng tongue. This is a female and 40 years old. Sa tongue description, meron siyang pale red with red sides. Okay? Observe po natin dito po sa sides, pale red and red sides. Ibig sabihin, meron siyang heat in the liver. Yung greasy white coating at the sides becoming yellow in the center. So check po natin yung picture. Meron siyang yellow in the center, meaning there is accumulation of damp heat transforming into phlegm-heat in the stomach. Yung rough, dry yellow coating in the center and posterior third. Check po natin yung picture. Nandito po siya. Meron siyang rough na coating, dry yellow coating in the center. Ibig sabihin, meron siyang damp heat transforming into phlegm heat in the stomach. Okay po? Yung symptoms, meron siyang constipation, stomach pain, meron siyang feeling of fullness in the stomach, meron siyang pain under the ribs, headache, and swollen fingers in the morning. Sa Western diagnosis, none. Background of disease, irregular eating habit, frequent bouts of gastritis during puberty, and emotional problems. Next case natin is a 29 years old female. Yung tongue po niya, meron siyang reddish and swollen. So check po natin, reddish tongue body, and this one is swollen po, indicating that there is retention of damp heat in the liver and gallbladder. Okay? Meron siyang red points at the tip. Check po natin yung picture. May mga red points dito po sa tip, indicating that there is heat in the heart blood. Meron siyang vertical crack with greasy yellow coating. Ito po, sa gitna, vertical crack with greasy yellow coating. Ibig sabihin, accumulation of phlegm-heat in the stomach. And meron siyang greasy thick yellow coating in the posterior third. Check po natin sa picture. Thick yellow coating dito po sa likod. Ibig sabihin, accumulation of damp heat in the lower burner. Okay po? Ang symptoms ng patient, meron siyang stomach pain when excited, burning sensation with urination, meron siyang yellow vaginal discharge, meron siyang burning sensation in the vagina, and pain during intercourse. Sa Western diagnosis, there is chronic urea plasma urealyticum infection of the urogenital tract. Background to disease, meron siyang irregular eating habits, long-standing unhappy marriage, and sexual problems. Okay, sa case history, for over 2 years, this 29-year-old banker suffered from a burning sensation when she urinated, a yellow vaginal discharge, and pain during intercourse. So yan po yung mga symptoms. Laboratory findings showed that both she and her husband had a chronic urogenital infection caused by bacterium ureaplasma. So parehas po yung babae and yung lalaki nagkaroon ng infection. The infection had been treated over the years by conventional methods, but it never cleared up for any length of time. The patient was unhappy in her marriage and constantly wondered whether she would divorce. The tongue coating was very greasy. So check natin yung picture. Thick and yellow in the posterior third. Her pulse was wiry and excessive. Sa analysis, the symptoms indicated a pattern of excess caused by accumulation of damp heat in the lower burner. This is manifested on the tongue as a thick, greasy yellow coating in the posterior third. Okay, yan po yung accumulation of damp heat. The excessive pulse also confirmed this finding of excess. Okay po. The tongue body is slightly swollen, shows some teeth marks, which suggest an underlying spleen chi deficiency with accumulation of dampness. So, di ba nabanggit natin nung mga nakaraang araw, yung swollen tongue, nakakonect po natin dito sa spleen Qi deficiency with accumulation of dampness. Despite this, the slight redness of the tongue body and the yellow thick coating must also be taken into account when formulating a diagnosis and treatment strategy. These two aspects point to the presence of damp heat, especially in the liver and gallbladder channels. So, ito po affected yung liver and gallbladder channel from the damp heat. The patient's long-standing emotional problem caused by liver qi constraint, which is confirmed by the wiry pulse and led to the development of heat in the liver. So, may heat in the liver, and the heat has combined with the underlying dampness to form a damp heat. This excess in the liver and gallbladder has impaired the free flow of qi in the girdle vessel. So, yung na-impede or na-impaired yung free flow ng qi sa girdle vessel. As a result, the binding function of this vessel has been impaired as reflected in the yellow vaginal discharge. Okay po? The red points at the tip of the tongue reflect the formation of heat in the heart, which was caused by the patient's obsessive thinking and emotional strain. So, pagkakaroon ng obsessive thinking and emotional strain, makikita po natin dito sa may tip ng tongue yung mga red points which indicates heat in the heart. Because of the interior-exterior relationship between the heart and small intestine channel, the heat has transferred to the small intestine. So, affected yung heart and also transferred dun sa small intestine. This is reflected in disruption in the secretion of body fluid and burning sensation during urination. Gynecological examination undertaken because of her pain during intercourse produced no findings. However, from the Chinese medical point of view, this was clearly the result of liver qi constraint. Okay po? Sa discussion, a greasy thick and yellow coating reflects a condition of excess. So, once makita po natin greasy thick and yellow coating, makapal, yellowish, and greasy, ibig sabihin there is an excess. Often, it occurs with acute symptoms. Even if underlying spleen qi deficiency is at the root of dampness, a tonifying strategy would be inappropriate. So, even po merong spleen qi deficiency na diagnose po tayo, dito sa case na ito, it's not good to tonify yung spleen qi. Initially, ang suggestion dito, the heat must be cleared. So, kailangan tanggalin po yung heat and i-resolve po yung dampness or the dampness dried. The patient should also abstain from alcohol, fatty, spicy foods, and dairy product to support the treatment. So, dahil may dampness, tanggalin po yung alcohol, fatty food, spicy food, and yung dairy product. So, dito, as nasabi ko po kanina, ang patient meron siyang spleen qi deficiency. However, hindi kaagad or ang management, tonification ng deficiency. Instead, ang gagawin po is to clear the heat and resolve the dampness. Okay po? Another case, we have a female, 37 years old. Ang tongue po niya is pale red and swollen. So, check natin yung picture, which indicates that spleen qi deficiency, accumulation of dampness. Yung patient, meron siyang red tip. Check po natin yung picture. This indicates that there is heat in the heart. Okay po? Yung greasy yellow coating from the center to the posterior third, ibig sabihin there is accumulation of damp heat in the liver and gallbladder. So check na po natin yung picture ng tongue. Yung yellowish greasy coating sa center to the posterior third. Yung po yung damp heat sa liver and gallbladder. Ang patient meron siyang symptoms ng distension and pain in the breast preceding menstruation. Meron siyang painful menstruation, irritability, fits of rage. Meron siyang lack of appetite, and flatulence and constipation. Sa Western diagnosis, there is fibroadenoma and cyst in the right breast. Ang background to disease, meron siyang repressed anger, irregular eating habits, nicotine, and cannabis abuse. Okay po? Next, this is the case of male, 53 years old. Ang tongue po niya, meron siyang pale red with curled up edges. So kung i-observe po nyo, yung sides ng tongue may curled up na pataas. Ito po yung mga sides. Ibig sabihin, there is liver chi constraint. Meron din siyang greasy thick yellow coating. Observe po natin na maigi yung yellow coating. Thick and greasy, which indicates accumulation of damp heat in the liver and gallbladder. Meron siyang old tin coating in the center of the tongue. Ibig sabihin, there is a stomachian and fluid deficiency. Ang symptoms ng patient, there is severe burning pain in the left waist area and chest. Meron siyang exhaustion, lack of appetite, severe dryness of the mouth, and there is rapid weight loss. Sa Western diagnosis, ang patient, meron siyang AIDS and post-herpetic neuralgia. Sa background of disease, there is viral activity and inability to eat. Okay po? So this tongue picture, this is a case of patient na may AIDS. Okay po? So hanggang doon lang po. Thank you for your attention.